I'm Mariella Payne, Senior Vice President for Policy and System Legislative Leadership at Ascension Health. We've been working with small business owners, many of whom are our board members, for the past year and a half to educate and inform them about the provisions in the Affordable Care Act to help small business provide health insurance. What we found is there was a lot of confusion over the law. There was a misunderstanding about what employers had to do or did not have to do. So we worked really hard to figure out a way to educate them about the aspects of the legislation that will affect them as small business owners. We were surprised that once we were able to provide non-biased, non-partisan information, there ended up being surprising, overwhelming support for provisions of the law to help them make sure they can get insurance for their employees, even though under the law, small businesses do not have to provide health insurance. But the three areas that we focused on were insurance reforms, state exchanges, and tax credits. One of the things that we also learned was that insurance reforms, while very complicated, was also one of the things that frustrated many small business owners for the past several years because of the way that they were being priced for their health insurance. And when we explained that many of the current practices that allowed insurance companies to rate their premiums based on the age of their workers, on the sex of their workers, on the health status of their workers, fundamentally meant that small businesses had a harder time to buy insurance. They were very enthusiastic about that portion of the legislation. The other thing that we discovered was that there was very little understanding of the tax credits or even awareness of the tax credits. So we actually helped several small businesses learn that they qualified for the tax credit and were able to actually get a 2010 tax credit. The state, when the state figures out how it's going to set up an exchange and implement the insurance reforms, it will matter in the future for small companies to get affordable, convenient coverage for their employees, or if they decide not to offer coverage, it's a way for their employees to go directly to the exchange and get insurance coverage.